So the base technology behind a biomechanics lab is the motion capture system. So these are very precise infrared cameras that track markers that we place on the individual. So up to 70 markers are placed on individuals from head to toe. And these cameras that are around the room in the biomechanics lab can pick up those markers in three-dimensional space with absolute remarkable precision down to sub-millimeter accuracy. And we can track all of those markers in 3 dimensions, and then through some digital post-processing, really help understand exactly how that individual is moving in 3D space. And we can also use force plates that are embedded within the floor to really get at some of those forces in how people are moving, not only the gross movement within that space, but the forces that they're putting on each individual limb. And we can do a lot of complex analyses that help us really get down to the most specific variables that you would want to ask or be able to evaluate for our patient population.
So in addition to walking in a straight line over ground, other technologies and equipment within this space allow us to capture other activities of daily living. For example, walking up and down an elevating ramp or walkway. You can also attach a staircase to that to allow them to ambulate up and down stairs. We have an instrumented treadmill, which allows us to force the speed at which somebody walks while also measuring forces that are developed in the handrails, which for a patient that maybe cannot fully weight bear, you can partially offload their body weight and actually measure those in conjunction, again, with some of the other motion capture technologies that we do as well.
We also have the capability to measure digital fluoroscopy of our patient population, which is effectively just a dynamic X-ray of those individuals.
So to supplement the optical motion capture measurements, we can also make measurements of muscle activity or electromyography, which allows us to understand more about how the actual muscle is controlling the observed movement. And to take that one step further, you can also measure brain activity using electroencephalography, which allows us to basically understand how the brain is specifically controlling the muscles that are in turn then controlling how your body is moving.
So we have a large 180-degree screen that 4 projectors project different immersive environments onto. In combination, there's a 6-degree of freedom motion platform that can move in all axes simultaneously. Embedded within that platform is actually a split-bed treadmill.
You can take a patient that has had a recent amputation and they're just learning to walk on their prosthetic leg and learning balance and weight shifts, and they can do that in kind of a safe environment on this platform, because we'll typically have them in a harness suspended from a frame above, so there's no danger of them falling. There's no fear of messing up, essentially.
As you can imagine, being immersed in an environment that's challenging your balance system, that's challenging your ambulation, that's challenging your cognitive processing, and also maybe introducing sounds or stimuli that may aggravate somebody with post-traumatic stress or various other forms of anxiety. If we can do that all in one setting, then we can hopefully be more efficient in our delivery of rehab.
You can bring a patient down that's maybe having some anxiety about going to a grocery store or an airport security check line. That, again, using that very immersive technology to recreate that in a controlled fashion where you can almost grade the level of challenge or the interaction with the environment itself.
They really get a sense of what it's going to be like to be walking on their prosthetic leg or using a prosthetic arm in this safe environment where they actually have to go out and do it.
Yeah, as the various medical fields advance, most of that advancement comes with true interdisciplinary collaboration. There's no way to bring advanced technology into clinical care if you're not mixing clinicians with scientists and engineers.
Our team is really the heart of what drives this program forward. We are very fortunate to have a very dedicated, committed staff of a wonderfully diverse portfolio of individuals that have varying backgrounds that are all complementary to help ask different questions and approach problems from different angles. Any clinician within the hospital, and frankly, within the NCR at large, can refer their patients to the biomechanics lab or the virtual reality lab and request a clinical evaluation or treatment of their patient for a variety of different conditions. We provide to them objective, quantifiable information that they can use to help inform their clinical decision-making in their clinical practice.
So in addition to providing, what we believe is very important clinical services, we also have a very active research program down here in the Gait lab and in our virtual reality suite.
The first of which being advanced rehabilitation sciences, the second of which being advanced orthotics and prosthetics, the third of which being medical surgical innovations, and the last topic area being epidemiology surveillance types of activities. So we have a very robust clinical and research program that are looking at things like low back pain, osteoarthritis, cardiovascular disease, and not only trying to track those conditions and ask the question, how many of our patients actually have developed these secondary health conditions, but also, when appropriate and when necessary, intervening with different treatment strategies, whether that be rehabilitation, a surgical approach, a next generation regenerative medicine technology that might include stem cells or biomaterials, to really either thwart or completely inhibit the progression of that secondary health condition.
Equally important, we have to recognize that even with the great advances in technology, whether they be in gait motion analysis systems, virtual reality platforms, or the latest and greatest prosthetics and orthotics that are on the market, they do not replace the human element that goes into caring. And one of the things that we pride ourselves at Walter Reed is that we do consider ourselves a family, and we're very proud of our beneficiaries and the ability to be able to take care of them. And it's that human element, I think, that makes a difference independent of what your facilities are like.